So we'll move on to nutrition and elimination. Chronic kidney disease defined as renal damage or GFR less than 60. Right there, please see table 47.6 for the stages of chronic kidney disease. Something tells me you will probably have exam questions over the 5 stages of kidney disease, so be sure to know those. Causes of chronic kidney disease can include diabetes, hypertension, infection, any sort of urinary tract obstruction, dehydration, renal artery stenosis. Clinical manifestations include uremia. That usually only happens when the GFR is less than 10. Polyuria is when your kidneys aren't able to concentrate urine. Oliguria and anuria. Hyperkalemia, and remember with hyperkalemia, be looking for cardiac dysrhythmias. That's usually when the potassium level reaches like 7 or 8. You'll see those peaked T waves. You could see disturbances in the sodium level. Sodium might be high, normal, or even low. And be sure to know those signs and symptoms correlated with, sodium retention, like hypertension or edema, heart failure. Metabolic acidosis is also a clinical manifestation of CKD, anemia, bleeding, and infection. And then here I have a chart of the clinical manifestations listed by symptoms. Be familiar with those. Assessment data for labs, you'll draw a GFR, a BUN, a creatinine, albumin, prealbumin. You'll see a decreased GFR, increased BUN and creatinine. You'll probably want to get a renal scan, CT scan, possibly even a biopsy. Treatment: preserve existing renal function, reduce the risk of cardiovascular disease, prevent complications, and provide comfort for the patient. Restrict high potassium foods and drugs. So when you're doing your patient education, be sure to tell them to stay away from foods with high potassium like oranges, bananas, leafy green vegetables, legumes. They want to limit their potassium to 2 to 3 grams per day. They also want to limit their protein intake, limit their water intake, which depends solely on their urine output, and then restrict sodium intake. Sodium intake should be between 2 and 4 grams per day. Treatments also includes calcium supplementation, phosphate binders, hypertension therapy, medication, and then medications are titrated to match the degree of renal function. For nursing interventions, you'll want to get daily weights, blood pressures, know your signs and symptoms of fluid overload, know your signs and symptoms of hyperkalemia. Be sure to reiterate to patients that they need to follow a strict diet, their strict diet guidelines. Let's move on to dialysis. So for this exam, you need to know hemodialysis, peritoneal dialysis, and the CRRT, which I think Angela talked about briefly in class. In hemodialysis, general information is the machine acts as the glomerulus. It's done 3 or 4 times a week. To prevent blood clots from forming, the patient's usually given an anticoagulant like heparin. Watch the patient for signs and symptoms of bleeding, and be sure to watch and monitor the patient for electrolyte imbalances and be sure to monitor blood pressure closely. In terms of vascular access, patients will need a fistula, could be an AV fistula or like an arteriovenous graft. Both, it requires a surgery, and then it takes a few weeks for that site to mature. During dialysis, 2 needles are actually inserted into this vascular access space. Be sure to never ever use the fistula for IV access. It's not meant for blood administration or IV administration, etc. Know that if the patient has a fistula in one of their arms, you should absolutely not be sticking that limb with needles. Nothing that's going to, don't put on a blood pressure cuff that's going to cause constriction to that extremity. You assess the fistula, palpate for a thrill, auscultate for bruit. And so that's hemodialysis in a nutshell. And peritoneal dialysis, the